Hello everyone. Today we will discuss about wounds. It is a 5-mark short note series question that is usually asked in surgery question paper. And in this video we discuss about what are the wounds, what are the different types of wounds and how long it takes healing, what is the etiology behind it, which will be useful for you both clinically as well as writing a theory answer question. So what is the definition of a wound? A wound is defined as a disruption in the normal continuity resulting from the physical, chemical, thermal or biological injury in the skin, mucosa or in underlying tissues. Wound repair is a complex, energy dependent, highly regulated biological process aimed at restoring the tissue integrity and function. So wound is classified based on etiology, nature, depth, contamination as well as duration. So there are 5 categories under which we can classify wound. So based on etiology we can classify wound as mechanical, usually caused by physical force like incised wound or lacerated wound. Thermal injuries usually caused by extreme heat or cold like burns or frostbites. Chemical wounds usually caused by corrosive agents like acid or alkali burns. Radiation wounds usually caused by ionizing radiations resulting in radiation ulcers, and biological wounds usually caused by living organisms like a snake bite or a dog bite. Based on the nature of injury, we can classify into incised wound, lacerated wound, abrasion, contusion and puncture wound. In case of incised wound, there will be clean cut edges caused by sharp objects. Lacerated wound, irregular torn edges caused by blunter trauma. Abrasion caused by superficial loss of epidermis. Contusion, closed injury with subcutaneous bleeding. And puncture wound, it's a deep narrow wound caused by pointed objects. Coming to the depth of the wound, it can be superficial, which involves skin only, deep when it can involve muscles, fascia or vessels, penetrating when it enters a body cavity, and perforating in which the wound has both an entry and exit points. Contamination wound can be classified into clean, which is there is no infection or inflammation. Clean contaminated, controlled entry into a hollow viscous. Contaminated, gross pillage or traumatic contamination. And dirty, wherein there will be established infection or devitalized tissue. Duration, acute or chronic wound depending upon the time of time for healing. If it heals with expected time and it shows delayed or failed healing. So the types of healing can be primary, secondary and tertiary intention. So primary intention, clean wounds with minimal tissue loss and sutured edges. Secondary intention, wounds with tissue loss healing by granulation and contraction. Tertiary, there will be delayed primary closure after infection control. So the wound healing process occurs in 4 overlapping phases involving coordinated cellular and molecular movements. They are hemostasis phase, inflammatory phase, proliferative phase and remodeling or maturation phase. So in hemostasis, which will occur immediately within minutes to hours, there will be vasoconstriction, platelet adhesion, aggregation and activation of the coagulation cascade with the fibrin and clot formation. So the major factors mediated are platelet derived growth factors and the transforming growth factor B, fibrin and fibronectin. Usually this helps in arrest of the bleeding, formation of provisional extracellular matrix scaffold. In case of inflammatory phase, it will occur within 48 to 72 hours, where there will be vasodilation, increased vascular permeability, neutrophil and migration, phagocytosis, macrophage infiltration. So the major factors will be histamine, prostaglandin, nitric acid, vegetative endothelial growth factor, fibrinogen growth factor, interleukins and TNF alpha. Here the main outcome is removal of bacterial or necrotic tissue and initiation of repair. Next coming to the proliferative phase, where it will take 3 to 21 days. Here it will be fibroblast proliferation, synthesis of type 3 collagen and extracellular matrix, angiogenesis, granulation tissue formation, epithelialization and wound contraction. The major factors include fibroblast, endothelial cells, keratinocytes and myofibroblast. Here the filling of wound bed with granulation tissue, surface re-epithelialization. In the remodeling phase, which usually takes weeks to months, there will be replacement of type 3 collagen with the type 1 collagen fiber realignment, capillary regression and ECM remodeling. Here the matrix metalloproteinases, that is the MMPs and the tissue inhibitors of MMPs played a key role. Here the role is increased tensile strength up to 70 to 80% and mature scar formation. So this is how the wound healing process initiates, wherein it will start with the hemostasis phase in initial minutes to hours, and then followed by inflammatory phase, where it will be about cleaning the bacteria or other organisms. Then the proliferative phase in the 3 to 21 days, followed by remodeling phase, which we have seen through. And in hemostasis, the predominant cells are platelets. Inflammatory, the predominant cells are neutrophils and macrophages. In proliferative, the predominant cells are fibroblast, endothelial, keratinocytes and myofibroblasts. And rematuration, it will be fibroblast and endothelial cells, including apoptosis. So local factors affecting healing. So infection, this is the most important cause of delayed healing, followed by poor blood supply, foreign body presence due to which will cause persistent inflammation. Poor blood supply actually causes reduced oxygen and nutrient delivery. Tissue necrosis, this prevents granulation. Wound tension, which predisposes to dehiscence. Edema, this impairs oxygen diffusion. Systemic factors affecting healing. So age, where it will be slower healing in the elderly. Malnutrition, which is because of protein, vitamin C and zinc deficiency, resulting in delayed healing. Anemia, reduced oxygen delivery. Diabetes mellitus, because of impaired immunity and circulation, this will prolong healing. Smoking causes vasoconstriction and hypoxia, resulting in prolonged healing. Steroids actually inhibit the inflammation and collagen synthesis, whereas chronic illness, there will be delayed cellular response from the immune system. Diseases with impaired healing. So pressure ulcers develop in immobilized patients due to prolonged ischemia and tissue necrosis. Immunocompromised stages such as HIV infection, malignancy, long-term corticosteroid therapy, impaired inflammatory and proliferatory response. Excessive healing response resulted due to hypertrophic scars and keloids due to abnormal fibroblast activity and excessive collagen deposition. And in case of diabetes mellitus, it causes impaired healing due to microangiopathy, neuropathy, impaired leukocyte function, reduced nitric acid availability, leading to diabetic foot ulcer. Peripheral arterial disease result in ischemic ulcers due to reduced tissue perfusion and hypoxia. Chronic venous insufficiency causes venous chases due to sustained edema, capillary leakage and inflammatory mediator accumulation. A wound is a disruption in the continuity of the skin or underlying tissue that triggers a highly regulated biological repair process aimed at restoring the structural and functional integrity. And wound healing is an active, energy dependent phenomenon that occurs through 4 overlapping phases of hemostasis, inflammation, proliferation and remodeling. The phases involve coordinated interactions between platelets, inflammatory cells, fibroblast, endothelial cells, keratinocytes, extracellular matrix components and growth factors. The type of wound and the method of healing may be primary, secondary or tertiary intention, and it determines the speed of the repair as well as the quality of the resulting scar. Normal wound healing is influenced by several local and systemic factors. Infection, poor blood supply, tissue necrosis, excessive wound tension healing delay the healing locally, while systemic factors like malnutrition, anemia, diabetes, advanced stage, smoking, prolonged steroid use impair cellular response and collagen synthesis. The failure of dysregulation of this healing process result in delayed wound healing, chronic ulcers or excessive fibrosis. Recognition of these mechanisms is essential for preventing complications and managing chronic non-healing wounds in clinical practice. I hope you have learned through this presentation. Thank you for watching.